Hello and welcome back to the Awaara Musaafir Show. Today we are talking about mental health. So in this episode I invited Anusuya, who is a clinical psychotherapist and a psychologist. We talked about mental health. So you just saw me cleaning my lens. तो हम लेंस क्लीन क्यों करते हैं? ताकि हमें जो एक तस्वीर है वो बहुत क्लीन दिखे, धुंध के बिना दिखे. एंड हमारे सोसाइटी के साथ कभी कभी ऐसा ही होता है कि जब हम उसे क्लीन पर्सपेक्टिव से नहीं देखते तो हमें बहुत धुंधली दिखाई देती है एंड हम बहुत सारे टॉपिक्स को बहुत इग्नोरेंट वे में भूल जाते हैं. एंड एक ऐसा टॉपिक है मेंटल हेल्थ जिसे हमने आज तक सीरियसली नहीं लिया इंडिया में. इंडिया का जो मेंटल हेल्थ प्रोग्रेस है वो बहुत स्लो है. एवरी लाइक 1 in 7 इंडियन इज गोइंग थ्रू सम काइंड ऑफ मेंटल हेल्थ इशू. 37% ऑफ इंडियन एम्प्लॉयज आर गोइंग थ्रू डिप्रेशन राइट नाउ. तो बहुत ज़्यादा ये एक इम्पॉर्टेंट टॉपिक है जिसके बारे में हमें सबको कलेक्टिवली बात करना चाहिए. हमें इसके बारे में जानना चाहिए. तो इस वीडियो में मैंने और अनुष्का ने बहुत सारे चीज़ों के बारे में बात की है, जैसे डिप्रेशन क्या होता है, एंजाइटी क्या होती है, एंड हमने इस बारे में भी बात की कि कैसे हम इसे ठीक कर सकते हैं. लाइक हाउ कैन वी गो फॉर अ थेरेपी, क्या होता है थेरेपी में. तो बहुत सिंपल चीज़ों के बारे में बात की है पर बहुत इंपॉर्टेंट चीज़ें हैं ये. तो जस्ट वॉच दिस वीडियो टिल द एंड एंड लाइक शेयर सब्सक्राइब गाइस. So, Anu, can you explain what you do exactly and what mental health is in general before we start the whole conversation?
Sure. So I am a clinical psychologist. What I do is I mostly do therapy with people, in which when people have any sort of mental health issues, big or small, right? So it could be something related to stress. It could be about making decisions, or it could be when you think you may have depression, or you may have something that qualifies for a diagnosis. That's where I would come in as a therapist, right?
Okay.
So a clinical psychologist is someone who has done an MPhil in clinical psychology in India. So you do MPhil after you finish your masters. It's a 2-year course, and it is done. So it's what you do is you mostly are trained to work with populations that have diagnosed mental health issues. Does that make sense? Please ask me at any point
sure.
if I am getting too technical.
Yeah.
Right?
Sure.
So that is, so what the difference between somebody who has an MPhil and who's done this is that, we are particularly trained in order to work with populations that have intense mental health issues.
Okay.
Right?
And there's this one question which I have, and I guess almost a lot of people will have the same question. That is, what exactly happens in therapy? Like, what is therapy exactly? And why do people go for therapy?
Therapy is a form of treatment. Okay.
Okay.
The idea, when it came about, the idea of therapy is that medication, jab therapy aaya tha, medications were very few, right?
Okay.
And what people realized is that talking really helps. Just talking about the problem. And while it sounds like commonsensical, it wasn't, right? You would go and you could be given electric shocks but never asked why you feel the way you do.
Yeah.
So that was seen to be very, very effective, right? And it was formalized by doctors and made into ये भी एक प्रकार का treatment है.
Okay.
ठीक है? So there is a particular way in which the difference between talking to your friends, say, and talking to a therapist is that our training is mostly to do with listening. We are trained to listen to you.
Yeah.
We are trained to pick up on certain things and basically do a very focused discussion about what's happening. Okay? So I work with adults. I work with people who are 18 upwards.
Yeah.
And I have had clients up to in their 70s as well. So I have, so mostly I work with that. But of course, you work with any age. You can work with starting from children. And the idea is expression. You allow a safe space. जो हम बोलते हैं ना, safe space जिसको हम कहते हैं, we don't often have it everywhere. When you're talking to a friend or a relative, your friend or relative wants you to get better.
Yeah.
Sometimes, how one feels, although they understand it, they care about you and they get it. Often what happens is, when you say the same thing again and again, it gets frustrating for the person. They're invested in your life.
Yeah. Yeah.
It can be कि तुम ये क्यों कर रहे हो? If you're breaking up with the same girl, why are you going back to her again and again? You
Yeah.
come and bitch about it every second day, but again you're going back.
Yeah.
I'm sure you understand these conversations, right? If you have broken up, why are you sad? If you did, you were not happy there anyway.
Yeah.
But the fact is, when you break up, you feel sad.
Yeah.
You feel
True.
what you feel, right? So
Yeah.
that's where somebody like a therapist comes in.
Okay.
So you have a place to talk about this and talk
Yeah.
about whatever you feel and
Yeah.
make sense of it.
Okay. So
Idea
it's
is
like
that,
a safe space to talk about anything that you feel. It can be
yeah,
happy. It can be like anything about happiness or any
yeah,
kind of emotion.
yeah. For example, for creators, this is something I feel that there is so much pressure to create new content
Yeah.
all
Yeah.
the time that, and it has been shown through multiple research that when you do anything, when you are being creative under pressure, your creativity goes down.
Yeah. Yeah.
And it, because it's under pressure, it helps to an extent
Yeah.
to have that, but beyond the point, when this is your job, so that does bring about another challenge to be
Yeah.
productive. So these are things that come about. What can you do about situations like this, which seem
Okay.
so simple? We all have it, but of course, if it goes out of hand, then you
Yeah.
need to see somebody. Other than that, you also have somebody who meets certain criteria for diagnosis, which
Okay.
is like somebody who is depressed, somebody who's anxious,
Hmm.
somebody who has schizophrenia or a mood disorder.
Yeah.
Okay, and these are, I don't know how familiar these terms are to you.
Yeah.
And are they familiar terms? We've heard them.
Yeah. Depression, anxiety on social media. These are two terms which you hear like every other day.
Right, right.
Yeah.
So now we all have some amount of sadness, we all have some amount of worry in us,
Yeah.
right? Now it's normal to an extent to have ups and downs there. Okay,
Okay.
like I will make a very simple analogy, and it's like when we have a body, we all have our problem areas and our areas of strength,
Yeah.
right? You know that stomach issues are something that
Hmm.
some people
Hmm.
struggle with, right? तो कुछ
Yeah.
हुआ तो पहले वही होगा. Whereas some people have an issue with, say, and maybe your strength is your body strength. You know that
Hmm. Hmm.
you have a lot of muscles, so you are
Yeah.
good at that, right? So now what happens is, similarly, our mind has sadness, happiness. Some people get sad more often, some
Yeah.
people worry more often. Now it can come under the normal ups and downs, right?
Okay.
The problem happens when that stomach ache becomes some sort of chronic issue, when the stomach ache
Okay.
is not going, when you're
Yeah.
constantly throwing up, when you're constantly sick. Now you need to go get investigated, and
Yeah.
only one I can think of is, say, you get a jaundice, right?
Hmm. Hmm.
And
Yeah.
when you get that, and then doing the simple things when you have a stomach upset, like ghar ka khana, this that, doesn't suffice. You need to get something else with it. The
Yeah.
treatment has to be targeted,
Yeah.
right? That is where you might need to see a doctor for medication to
Hmm.
manage your the biochemical part of it, and you need to see a therapist to manage the psychosocial part of it,
Okay.
right?
Yeah.
Psychosocial parts would be the way you think,
Hmm.
the way you understand the world, how
Yeah.
you tell yourself about your life,
Yeah. Yeah.
right? We all talk to ourselves about our lives and how that story goes. So
Yeah.
all these things come into what we will talk about in therapy. I
Okay.
have said a
But
lot, but did it make sense?
yeah, yeah, it did. So I wanted to know one thing. Is it possible that someone is going through mental health issues and he or she is not aware about it?
Oh, absolutely. Absolutely. It's a very, very common, and it's something that happens that, you usually, because this is where awareness comes in, when you are sick and when you've been managing with something which is difficult for
Yeah.
a long time, particularly, the it is very hard to know when you can't manage it anymore, when you need help. And
Yeah.
oftentimes, because, and this is where stigma comes in.
Yeah.
This is where our first instinct is to say that, like, I'll talk to people around, I'm talking
Hmm.
to this
Hmm.
person.
Yeah.
When things get really bad, that is when you seek out help,
Yeah.
right? So
Yeah.
something that could have been a sprain can
Hmm.
become a broken bone.
Okay.
So early intervention नहीं हो पाता उस समय.
Huh.
So that is very common, and it's because we don't know, right?
Okay.
We don't know when it's different.
Yeah.
Sometimes, it takes the first person who has to admit that something is wrong is you
Hmm.
yourself,
Yeah.
right? So yeah. Hmm.
So, like we are talking about that people are not aware about mental health, and
Yeah.
every other day we get to hear on social media like someone is posting I'm depressed, someone is posting I have anxiety issues. But what exactly is depression and anxiety? Because these are like the most common terms which you hear, but a lot of people
Hmm.
don't know what exactly they mean.
Okay, so depression is like a group of disorders.
Okay.
Okay, this is something to do with your mood when one is sad and one has been sad for a long time.
Hmm. Hmm.
Okay, for example, in very simple terms, if I have fever, and if I have fever constantly for 7 days, 14 days,
Yeah.
that is concerning. If you have fever for one day, you can take a medicine and feel better, and
Okay.
it's
Yeah.
okay, we'll go back.
Yeah.
But say if you have fever from constantly for 14 days, or if you say have had fever up and down for months at a time,
Hmm.
ठीक हो जाते हो बट फिर से हो जाता है, ठीक हो जाते हो फिर से. And now that fever is coming into different things. You can't work like before, you
Yeah.
can't talk to people like before, you can't do things that you used to easily do before. So
Yeah.
that is when we will say कि डॉक्टर को दिखाओ. This is no more just a fever. There might be
Hmm.
something that you need to find out what it is.
Yeah.
Okay. So this is what the difference would be between being sad and being clinically depressed.
Okay.
Right?
So,
So
depression
depression or
is like,
anxiety. Hmm.
yeah. No, no, go ahead, go ahead.
You go ahead, please.
So
Depression is
I was asking like depression in some way is like stress, like extreme amount of stress.
stress can cause depression, but stress is
Okay,
not the
okay,
same as depression.
yeah,
Stress is when you feel that what I have to do is too much. जो
okay,
चीज़ों से मुझे
yeah.
डील करना है वो मेरे एबिलिटी से ज़्यादा है.
Hmm, hmm.
ठीक है. जैसे जब एग्ज़ाम के टाइम एक होता है, दूसरा
हाँ,
होता है अगर कोई बड़ा इवेंट हो रहा है,
हाँ,
अपनी शादी हो रही है या किसी पास वाले का हो रहा है, देयर आर लॉट्स ऑफ थिंग्स टू डू,
yeah, yeah,
राइट? इट कैन बी स्ट्रेसफुल.
yeah.
इतना सब करना है, देयर इज अ डेडलाइन, हाउ डू आई फिनिश
Hmm,
work, etc., right? So that's
yeah,
stress.
okay,
Depression is your response. Now if
okay,
I am dealing with stress
yeah,
and first you are like ठीक है मैं कर लूँगा करूँगा करूँगा ठीक है.
hmm,
Now if the stress has been going on for a long time,
yeah,
like when you are studying say or when you are looking for a job,
yeah,
you've been stressed for a long time, and there what happens is stress ka response is stress just tells your body ki you have to do something. There is danger, there is something that has to be done, you need to take action or you need to get away from the situation, you know
yeah.
and or when it gets hard you just play dead and you say ki you freeze, I can't do
Hmm,
anything,
hmm,
I'm
hmm.
done,
Yeah,
right? When you start having that response and you can't no longer deal with it cognitively, that is when we start showing signs of other things, right?
okay,
So depression would be when you've been sad for a long time.
okay, yeah,
Anxiety is when you have been feeling worried to the
yeah,
point now you must have been worried in your life.
yeah, yeah.
Now, similarly, now all worries are not the same. Sometimes you have a small worry, sometimes you have a big worry.
Hmm,
Sometimes the worry is so bad that you need to talk to somebody and figure it out, or
yeah,
it's a lot basically. Okay,
yeah,
so when you have been going through a lot of worry, then हर चीज के लिए लग रहा है कि नहीं होगा, अब कैसे करूं? Your body shows signs of it, that
Okay.
your stomach hurts, you feel butterflies in your stomach, you have pain in your body. Then again, that would then you need to see whether or not you need a diagnosis, or whether medicine can help
Okay.
you, or whether you need
Yeah.
to go in for therapy. That
Yeah.
is no longer stress. Now you're responding with to stress with this particular issue, right?
Yeah.
Stress to hai, stress to hai, but these are basically mental health issues. So this
Okay.
is a disorder.
Yeah. So I wanted to ask you, if someone is going through depression, anxiety, or any kind of mental health issue,
Hmm.
and it's not treated for a long time, then what can happen to that person? Like, are there any extreme things that can happen?
The way so different things happen. Now, one is if it goes untreated for a long time, especially depression, it can be fatal,
Okay.
right? Because in depression, and the thing with mental health issues are a lot you are experiencing it in your body and mind. There is a big physical component to mental health issues as well. So when you are experiencing that, your mind is basically telling you, I can't do this anymore.
Okay.
Your mind is telling you that, I'm sad and things
Yeah.
are just not getting better. And doing things that keep us alive and well, like getting out of bed, brushing, meeting friends,
Hmm.
doing something, those become difficult. Gradually, if you continue that way without being treated, it affects your memory, it affects the way you concentrate.
Okay.
It's hard to remember things, it's hard to
Yeah.
do things, like be as sharp as you used to be.
Hmm. 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 Yeah.
And so, what happens is, and for depression particularly, the risk is that there is a risk of suicide, that you might
Yeah.
think at some point that, it is just too difficult to go on living. And unlike a lot of narrative we have around depression and suicide that says that a person makes a split second decision,
Yeah.
for sometimes the ones that actually work are the ones that are thought out, because the
Okay.
person has
Yeah.
been going through it for so long
Yeah.
that
Yeah.
they honestly make a choice that, it's really hard to continue,
Yeah.
and it's just easier. And that time your mind does say things to you like, it will just be easier if you're not there,
Yeah.
so it's not. So basically, as the disease progresses, sorry, as the disorder progresses,
Hmm.
it is harder and harder to think clearly,
Okay.
right? When I'm
Yeah.
stressed, when I have some level of awareness, I can differentiate between what is it that I am thinking, feeling, doing versus
Yeah.
what it is that is not normal to me.
Okay.
One thing that I hear a lot when people come is that this is not me. मैं ऐसी नहीं थी.
Okay.
You know, 2 years back, 3 years back, 1 year back, I wasn't like this.
Hmm.
I
Hmm.
didn't think like this,
Yeah.
right? So that is where you know that, it's not just you, something else is happening here, and that is a
Yeah.
disorder, and it can be treated, and you will get better, and you will go back a
Okay.
little wiser.
Yeah.
So, yeah, so that is what we start out with. Now, for some people who are high functioning, you
Yeah.
can't see the signs. For a lot of people, you can see when they are there, when they feel things. Okay,
Okay.
when somebody is sad, or you will see that they are irritated, they're
Yeah.
sleeping here and there, or they are not sleeping at all,
Yeah.
or
Yeah.
they are not eating, they have lost weight, they have gained
Yeah.
weight. People see they are not taking care of themselves like they used to,
Hmm.
right? So you can tell. Now there are some people for whom you can't tell
Yeah.
because they manage it very well.
Yeah.
Hmm? It is they know it internally. They know they are not feeling very good. They know that things are not going well, how effortful it is,
Yeah.
So there it's harder to pick up. That
Okay.
is where, the awareness needs to go up, and, people need to, that's where, social support helps. When
Yeah.
you
Yeah.
have people who make this, who make going to therapy normal, who
Hmm.
make
Hmm.
taking care of yourself normal,
Yeah.
and taking care of yourself, by that I would mean taking a mental health day. If one day you don't feel like going out with your friends because
Yeah.
you're not feeling great, it's okay,
Yeah.
right? Versus if you
Yeah.
have somebody who's doing it constantly, that is
Hmm.
something to worry about.
Yeah. Okay. I
Makes
got the
sense?
hang of that.
Hmm.
Yeah.
Yeah.
Cool.
So
So
oftentimes, yeah.
yeah. So like if there's someone like for example, if there's a friend and he or she tells me that, hey, listen, I feel like I am depressed. So what should be my reaction? Like, how should I talk to them? Because a lot of times the first person anybody goes to is their friend or someone in the family, right? So how should someone talk to a person who is like who is depressed or feeling anxious or something like that?
So tell me something. If you hear, if anyone, if somebody you love tells you that, hey, I think I am feeling depressed, how
Hmm.
do you feel? How do you feel generally?
So that's the
Think
thing,
about
because I don't know how to feel at that moment. Like, it's
it. You
really
must be
confusing.
feeling something. You must be
Like I
feeling
feel,
something.
so I feel bad because like
Okay.
because I don't know, I can't, in some way I know that I need to help that person, but I don't know how to help that person. So that's
You
the feeling I
you
get.
don't know. You feel helpless.
Yeah.
They have come to you and they want you to. And the first thought that you have is that I need to help this person.
Yeah.
Now, when we feel helpless, it often comes out as us trying to do for the other person what they need to do for themselves.
Okay.
You know, so it's like saying कि अच्छा तू चल नहीं पा रहा है, I will help you out.
Hmm. Hmm.
I will carry this,
Hmm.
right?
Yeah.
Now that is a short-term solution. The first way in which what you do is, I digressed a little. The way you respond is to remember that it is about the other person, to offer them a
Yeah.
space to talk.
Yeah.
If you are up for it again,
Yeah.
if you are say in the middle of something and you get a call like this, it is very important to remember to tell the person this is not a good time, but I will get
Hmm.
back to you, and have
Yeah.
a conversation and give it the time and space that it deserves,
Yeah.
right? Because one of the things that anybody who's coming to you and trusting you with this is they need some space to feel like they are not abnormal. It's okay to feel this way,
Yeah.
right? And when I am in a place where my first instinct is I'm scared. I'm like, now what do I do? How do I help you? You
Yeah.
know, it's important to remember, that just listening is helping also, and you can
Okay.
figure it out. Right now, you just give the person a space to sit and talk. Do you want to talk about it?
Yeah. Yeah.
You know, what makes you feel that way,
Yeah. Okay.
right? Things like that's therapist talk, but generally you would say that do you want to talk about it? That's maybe
Yeah.
the first thing that you say. Or something like it's okay to feel the way you feel,
Yeah.
and it's important during the conversation. What you might hear may not be so. Like you said, people use the word very frivolously nowadays online,
Yeah.
which
Yeah.
is a good thing and a bad thing, right? The bad thing is you don't know whether or not this person actually is
Yeah.
depressed, or whether this
Yeah.
person is saying they are being dramatic, or they are being ki, oh my god, I'm so sad. Now, here the thing again is I would usually err on the side of caution,
Hmm.
right? And it is, of course, both are possible, but to hear somebody out is basically to not judge why they feel that way. I had a breakup 3 years ago and I am still upset about it,
Yeah.
right? It is easy in that space to say that, oh, 3 साल 3 साल पहले 3 साल हो गया अब क्यों,
Hmm.
right?
Yeah.
That becomes hard for the person to continue and open up. The
Hmm.
other is offering solutions.
Okay.
Offer solutions much later. First, hear it out.
Yeah. Yeah.
तो ये कर सकता है, ये कर सकता है, ये कर सकता है. There is a chance the person who has confided in you will talk to you about it a few more times if
Yeah.
you are someone who can listen, right? it's always good to remember how much you can handle.
Okay.
Right? It's like if somebody comes to you with a पैर टूट गया है and says it hurts, you can help them to a particular place.
Yeah.
But long term mein, you can't carry that person, and
Yeah.
that's
Yeah.
not the thing that you need to do. You
Yeah.
need to make sure the person reaches a place where they will
Yeah.
get help.
Yeah.
Right?
True.
So do as much as you can, and oftentimes, you know, we get so worried that somebody is sad and they depend on us, we can't let this go. Sometimes it's
Yeah.
important to remember that you can't do beyond the point.
Yeah.
If
Yeah.
there is extra help needed, if the person needs to see somebody, they need to see someone. You can't be the
Yeah.
person who gives that particular service because it is a specialized thing.
Yeah.
Right? And it helps to normalize therapy. If you have been to therapy, it helps
Hmm.
to tell them that, you know, I have been to a counselor, and you know, if you want to, if it's the first time, you can help them find out names and, you know, basically go through the process.
Yeah.
There is a thing we call normalization, when you make things normal
Yeah.
for that person, right? Like, how
Hmm.
would you feel if you are sick and somebody and you say, hey, I think I have fever, and they say corona ho gaya tumko.
Uh-huh.
Versus if they
Yeah.
say okay, bimari hai, let's see, let's take it step by step.
Yeah.
It's like that.
Okay. Cool.
Yeah?
So, uh, there's this point in 2020 now that every other person is a content creator and every person is on social media, be it a content creator or not. Everyone is
Hmm.
on social media. We are consuming content like on Instagram, Twitter, YouTube. There's a lot of this clutter around. So
Hmm.
I feel like, and there's also pressure on everyone कि जो content creators हैं उनके लिए तो there's this pressure कि they have to create content, and for the
Hmm.
people who are not content creators, उनके लिए pressure is this कि they need to consume the content because your friends are watching something, so even you need to watch that. It has become like that compulsion. So I feel like a lot of stress, like depression, anxiety, and all the other issues happens because of this. So
Hmm.
how can someone deal with all of this in 2020 and beyond that? Like,
Generally, you know, I would say too much of anything is dangerous.
hmm,
Right? When you are only doing one thing, that is, you know, it's very hard for one thing to keep making you happy.
yeah,
So sometimes it might be important to just limit what you
hmm,
do,
hmm,
how much you do it.
yeah,
So if I am somebody who's creating content, it might help to have a division between work and play.
yeah,
It is okay to be creative and think
yeah,
creatively if that's what you do, right? But sometimes it might help to at some point switch off and say, okay, this is my personal life, and you know, this is my
hmm.
professional life.
So this, and also in this pandemic for like last past 8 months, it's been a complete lockdown. And before that, there was like this sudden emergence of gaming. So people just forgot what it like, especially kids. They just forgot what it feels like to go out and play. Like when I was a
Hmm.
child, I used to play literally every day. And
Hmm.
now when I see my cousins or my brother, they are just
Hmm.
on their laptop, on their phone all the time. So
Hmm.
how to deal with all of this, like how to get out of this dark place.
Okay, so when you are there, it doesn't feel like a dark place. You do it because that is interesting,
Yeah.
right?
Yeah.
If you want somebody to do something, the best way is to do that by example.
Hmm.
If you want somebody to play, then you go out and play a fun thing with your friends.
Yeah. Yeah.
Make it seem like something that is fun. So you need
Yeah.
to go have fun if you want your brother to think, okay, that's interesting.
Hmm.
And it won't happen in a day.
Yeah. Yeah.
You know, it's always more effective than telling the person ki ye mat kar, ye, you know, this is not good,
Yeah.
this, that. It helps to, you know, schedule something like, you know, ki, you know, to plan things which can be fun without involving gadgets in it,
Hmm. Hmm.
getting other family people involved,
Yeah.
doing some things which, you know, they have to be fun. That's important because, you know,
Yeah.
computer gaming is fun. What is the person getting out of it?
Yeah.
If
Yeah.
you take away something, there has to be something that the other person also gets, right?
Yeah. Yeah.
So yeah, then see what is fun for them. Is
Hmm.
cooking fun? Is sitting with the family fun? Is
Yeah.
making something fun? So does so that's what I would say. If you want to encourage people to do other things, then you need to make them seem attractive, and
Yeah.
it also helps to schedule things with them.
Yeah. Yeah.
Let's go out and do this, or let's play. When do you
Yeah.
want to play? Get a board game. Start small. You know,
Okay.
so
Yeah.
start that way.
Okay. So, to come out of this topic, like, and talk about the real world issues, right now in India, there are like thousands of problems. Not even in India, in the whole world, a lot of problems are going around. And what I see is that, like, for example, the recent Sushant Singh Rajput case, then the Hathras case, and there are many other cases, and all these cases involve women, and all these topics are revolving around women. So how do you feel this affects the mental health of women in general in India or anywhere else?
As a woman, one of the things that one grows up with is the issue with safety. You know,
Hmm.
so
Hmm.
when I was talking about need a safe space,
Yeah.
a safe space, an emotional safe space is with a therapist. These are
Yeah.
about the spaces we are in
Yeah.
and how unsafe they have become for us as women. And it is scary, like, when we talk about the Sushant Singh Rajput case, which was a terrible, terrible tragedy, and the way in which it was handled, and the
Hmm.
way in which you had certain sections of celebrities saying कि depression कुछ नहीं होता,
Hmm.
or
Hmm.
people talking about sermonizing suicide, that
Yeah.
it's you shouldn't do this. Those have been triggering to a lot of people, in the sense that you have it's your reality, it's something you deal with, and suddenly you have a group of people saying that the way you deal with it is not okay,
Yeah.
you know and they have no idea about what you're going through, so that makes it worse. So a lot of women, a lot of men have come out against it, talking
Yeah.
about it,
Yeah.
and claiming back that space, that you don't kill yourself out of whim, you're doing it because you're really, really sad, you really don't see another solution.
Hmm.
So, but at the same time, I don't know if you noticed, there is this process also going on, which is othering, which is basically you tell people कि तुम अलग हो, तुम हम जैसे नहीं हो.
Yeah.
जैसे for Riya Chakravarti, the whole narrative is about, oh, she's not like me or you because
Yeah.
she is a celebrity. B, she was his girlfriend and she used drugs,
Yeah.
so she's not like me and you.
Hmm.
With the Hathras case, the fact is the girl was Dalit.
Yeah.
You know, and that is a big part of why what happened to her was handled the way it did.
Yeah. Yeah.
So, these are very intersectional issues. These are not just women's issues. These are also issues with, which have other elements to it that impact it. Like,
Yeah.
Hathras case clearly. Riya Chakravarti's case also, it's something that brings about, our age-old understanding that, a woman is somebody who fixes a man.
Hmm.
And yeah, you don't realize, the cost it comes with.
Yeah.
So that is something that again it brings up questions about relationships and what is healthy and not
Yeah.
healthy in it.
Yeah. I wanted to ask you in general about, like, what needs to be done to deal with these sort of issues, because every day when you open newspaper, some or other incident is something like this. So how can you deal with such problems?
Deal with it personally or deal with it in a social capacity.
I want to ask you in both ways, like how can I
Mhm.
deal with it personally and in a social way as well?
Personally, sometimes it helps to limit content, to remember how much you can do, what you have control over.
Yeah.
Because when you open the newspaper and you see it, it is very, very traumatizing.
Hmm.
And yeah, I think I get the gist of your question now. For women and mental health, there are certain extra issues that women experience, which is unique to their demographic.
Yeah.
Men also have issues that is unique to their demographic.
Yeah. Yeah.
But because we are talking particularly about women and the incidents that have happened, it is also something which it might be a good thing to limit content to see whether what you can do in your own life, because
Yeah.
seeing that can be triggering.
Hmm.
you know See as much as you can handle. If you
Yeah.
can't handle it, that's okay. Look after your own mental health. And personally also, some it might be a good option to ask yourself what you are doing in your life to take care.
Yeah.
And when it comes to a partner's mental health, again, uh, the Sushant Singh Rajput incident also was a lot about men's mental health issue. If you
Yeah.
see
Yeah.
the
Yeah. Definitely.
reaction to it and the way
Yeah.
it happened, it's very different. It's so much easier for people to accept that a woman is depressed
Yeah.
than a man is depressed,
Yeah.
right? So that again becomes a huge barrier in seeking help. So I
Hmm.
hope that at least highlighted to people how vulnerable men can also be
Yeah. Yeah.
to mental health issues. And
Yeah.
again, if you're a man and it's triggering you, and if you feel like you want to do something differently, then seek help if you need to.
Yeah. And I guess for
Right?
men, it is also a thing in India that since childhood, every boy is treated like, and he has been told कि रोना अच्छी बात नहीं है. So there's this constant pressure कि I cannot talk about this with anyone. So there's that thing as well.
Yeah, you can't talk about it to anyone. For again, not all, but sometimes as a boy, you may not have a space to talk about it.
Yeah. Yeah.
You may not have friends or family who would understand.
Yeah.
Whenever you try and talk, you get shut down.
Hmm.
So you're like, इसके पीछे रो रहा है, इतने दिनों से रो रहा है, what's the big deal, right?
Yeah.
So that is something that happens. So it is, what you said is very true. So it is about creating those spaces. And like, in a personal capacity, it's important to claim that space and to say
Yeah.
that I feel this way, I am sad, or I need to talk about this, or I feel
Hmm.
anxious, and cry
Yeah.
if you want to. Like, give
Yeah.
yourself permission to feel
Yeah.
the way you feel, and in a larger context, it is also about being able to maybe give somebody else that space. So if your friend comes to you and he's upset, you listen to them, because
Yeah.
we have all been brought up this way. And
Yeah.
it
Yeah.
is something that is we have to work through. When
Yeah.
another man comes to us who is sad, the first instinct is, even though you know better, he
Hmm.
रो रहा है, इसके पीछे रो रहा है. So
Yeah.
just working on your instinctive feeling.
Yeah.
He can cry, and being comfortable with the
Hmm. Hmm.
discomfort.
Yeah.
When we feel uncomfortable, when people cry, it's uncomfortable to see.
Yeah. Yeah.
When a man cries, it's even more uncomfortable to
Yeah.
see. So giving a safe space is getting, being able to sit there. See, this
Yeah.
person is crying, I am not comfortable, but I am still here. I am
Hmm.
not telling the person to shut down. I'm not telling the person why. I am just sitting here, you know,
Hmm. Hmm.
and
Yeah.
hopefully that helps the person feel like it's okay to feel the way he does.
Yeah. Yeah.
Yeah.
Okay. And one last question before we end this podcast. In India, mental health in general is not, everyone is not aware about it. So, according to you, what needs to be done, and how can people get aware about their own mental health as well?
you know First thing is education. It's about understanding that we have a body, we also have a mind.
Yeah.
And mental health mental illness is not something to be scared of.
Hmm.
I have heard people asking ki, how do we make sure we are never depressed.
Yeah.
Now,
Yeah.
some people might biologically be predisposed. There might be
Hmm.
different factors, and of
Yeah.
course, nobody is saying you get depressed. But if you get depressed, that's not the worst thing that can happen. Get help.
Hmm.
Like, help is available. There is no shame in seeking help. right? One of the first things one can do, I think, is lead by example, and this is where I feel content creation has had a huge role in.
Yeah.
So a lot of content I consume is about people who talk about going to therapy, who talk about
Yeah.
growth they have had, and it's wonderful to see, just
Yeah.
normalizing it, talking about it as something that one does.
Hmm.
So, when I see it, it's easy for the next person to say, "Okay, okay, you can go.
Yeah. Yeah.
I can think of this as an option."
Yeah.
So, that is the process of normalization.
Yeah.
You know, we are often afraid of having these conversations, and, just having them, I think, is a good place to start.
Yeah.
The other thing is also knowing, how much you know and how much you don't know. Right now, we don't know as much about
Hmm.
mental health issues. So it helps to ask if somebody is going through something, and if they are comfortable talking to you about it in a personal capacity, it might help to know, hey, what is it like?
Hmm. Hmm. Yeah.
You know, and give the person an opportunity to share.
Yeah.
And if somebody has been in therapy and is in it or not in it now, or is doing it for a few years,
Yeah. Yeah.
it might help to ask and see, what do you talk
Yeah.
about? What is it like? You know, so just making it more normal that way, learning more about it to find out.
Yeah. Yeah.
And also, I would want to take this opportunity to just let people know what are the qualifications you should seek out when you see a
Yeah. Yeah. Yeah.
professional. Is it okay if I do that?
Yeah. 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 Please do that.
So, okay, so we have psychologists and we have psychiatrists. So, psychiatrist is a doctor. He has
Hmm.
an MBBS degree, and they mostly, the doctors give medication. Some
Hmm.
psychiatrists also offer therapeutic services. So, they also do counseling or
Yeah.
therapy. Okay. Now, with medication, the whole idea is the intervention is कि whenever there is any sort of mental health issue, there is an imbalance that you have of the brain chemicals,
Hmm.
to make sure that is okay. So what happens is it makes it easier. जो बहुत बुरा लगता है वो कम बुरा लगता है,
Okay.
and then
Yeah.
it becomes easier to do things.
Yeah.
Like I can't attend to something, I can't focus, it
Hmm.
helps.
Hmm. Hmm.
It
Yeah.
really helps a lot of people with thoughts of suicide.
Yeah.
Often a lot
Yeah.
of people come when they start thinking of dying, and then they are like, I don't think like this. This is, I
Hmm.
never
Hmm.
thought
Hmm.
like this.
Yeah.
Right? So it can help with that too. Right? Now therapy is different from that. Therapy is mostly a conversation. It's about you figuring out ways to help yourself. So
Yeah.
it's a lot of work for the person involved.
Okay.
It's of longer duration. Therapy would be for about 50 minutes,
Hmm. Hmm.
once a week or twice a week or once in 2 weeks.
Yeah.
Depends on what the
Yeah. Yeah.
person needs and where the person is, right? So it's more frequent meetings than a medication.
Yeah.
Here you have more place to talk. You are focusing more on what action you want to take, how you feel, right? It's
Yeah.
more to do with these things than to do with what are my symptoms, and uh, you take a medicine to feel better about it,
Yeah.
right? Both together have shown to have very good efficacy for many things, but you can do what you feel is comfortable to begin with, and
Hmm.
then move up to getting
Yeah.
all the help that you need to
Yeah.
help yourself.
And people also
And
need to like take advice of someone who is professional like you
yes,
and not advice of influencers. So I just wanted to plug that in. You can
thank you.
continue
That's
about
so
that.
important
Yeah.
because because we all again have a
Yeah.
mind and we have opinions about it. It feels like it works for everyone. Now the
Yeah.
thing is, what works for you may not work for another person, and that's
100%.
okay, right? Where now this is where mental health professionals comes in. So somebody who's trained knows this.
Yeah.
Somebody who's trained and who's competent will know that I may suggest 5 things to you, but none of them might work. So we
Yeah.
need to
Yeah.
figure out what to do. The
Yeah.
issue is not with you. The issue is with the suggestions. You need one that
Hmm.
works for you,
Yeah.
right? So in order to do that, so just like you wouldn't go to anybody. So now, for example, say if somebody has had a lot of experience with, surgeries, you will
Hmm.
not go to somebody who can do surgery on you.
Yeah.
Similarly, if somebody has had difficulties in their own lives and dealt with them, it may not make them the best person to give out advice. It
Yeah.
it's a dicey thing, right?
Yeah, yeah,
It's they have wisdom, but it's not a trait. It's not something which is deliberate.
yeah,
There's a lot of part which is deliberate.
yeah.
So somebody who is a qualified professional will have a master's degree at least in counseling
Hmm.
psychology. Somebody currently in India, the professionals would be somebody who is people who have a license right now are clinical
Yeah,
psychologists who have done a master's and then an MPhil. So it is important to note those things, the kind of therapies that they offer,
yeah,
people they work with. So they help. Sometimes someone who has done a master's may not always be qualified to help you. So
yeah,
it's important to maintain caution there,
yeah, yeah,
right? A master's in psychology counseling. So, these things are important. And also, like, all doctors are not a good fit for you.
yeah,
It's important to find a mental health
yeah,
professional who gets you. So, it's okay if one person doesn't work. There are lots of them out there. And, you can seek help and
yeah,
see who works for you better. So, meditation, doing exercise, yoga,
yeah,
these things generally help us, release these neurotransmitters that make you happy, make you feel calmer.
yeah,
So
yeah,
it's a really good practice to include it in your life, along with other, other practices like having a hobby, spending time with people, you know, doing
yeah,
things which are not just digital. So it's always a good practice to have to
yeah.
include. In fact, there is a form of therapy in which meditation is used. It's called mindfulness.
Hmm. Hmm. Yeah,
Do look it up if you get a chance.
yeah, yeah,
It
yeah.
uses the principles of meditation into formalized work.
Yeah. It's
So
like
it
a
is.
lifestyle for you.
It is. Yeah, it becomes that. I guess it's a form
Yeah,
of therapy, though. That's the
yeah,
context in which the idea is it becomes one. Yeah. So
yeah.
yeah.
Okay. So thank you, Anu, for coming on the show and talking about mental health. I guess
My
like a lot
pleasure.
of I can't even thank you enough for this thing, because I really wanted to talk about mental health and tell other creators and whoever is watching this video that it is completely okay, and we need to start talking about this thing, because I don't know what will happen if we just keep being ignorant and stop talking about what we feel. So I hope so people get encouraged to go for therapy and start doing meditation for that matter. So yeah,
Yeah.
thank you so much for coming on the show and talking about all of this.
It was a lot of fun for me as well. So thank you.
Same here.
Very
Yeah.
good questions.
Thank
Take
you.
care, Jayesh.
Yeah,
Bye.
same to you.